It's from Latifa. And what would you suggest to do to help ensure our rural communities and our already shrinking county hospitals have the resources they needed to cope? So let's start with Heidi, and then we'll move to the doctor too.
Well, we've been working very closely. One of the things that you have done is expand Medicaid, which has been so significant to keeping our rural hospitals going. I think that the most significant thing that we can do is figure out how we're going to deploy resources to keep hospitals cash flowing. What's happening right now in the healthcare industry is that they aren't doing elective surgeries, a lot of hospitals. They aren't doing the things that produce the revenue, and that's creating a cash flow shortage. And so I would say the first thing, when you're looking at supplies and equipment, the first thing that we need to do is we need to keep hospitals solvent. There is a lot of money in the stimulus bill or in the recovery bill that the Congress just passed to help with hospitals. I think the other thing is we continue to look to the federal government. Where are the respirators? Where are the masks? Where's the personal protection equipment? And at some point, they have to get this together and realize that we need an Amazon kind of distribution system so we can rapidly deploy those kinds of that equipment to help solve these problems if you're in a rural hospital and you only have one ventilator or two ventilators. That may be inadequate in a breakout. And so I'm hoping that the federal government and encourage your senators to encourage the administration to do a better job in identifying and deploying those resources.
Dan, I 100% agree with what the senator said as far as supporting all the hospitals that have just had their revenue disappear, much like all of us have seen our jobs disappear with this. All elective clinic appointments and surgeries are canceled. The other thing we can do to save our rural hospitals, there are two things. One, we need to social distance like crazy, like we really mean it. I feel like in Iowa City we are, but I don't know I can only kind of see what's around me. And so we got to stay home to save lives. If we don't spread it, then this virus will not impact our communities as our worst fears. And the second thing we need to do is ramp up testing again like crazy. We need to have drive-through testing almost everywhere in all the 99 counties in Iowa. We need to have it available readily. And then we can see where the hot spots are, and we can plan not only where to get resources to, as the senator said, in an Amazon way, but then we need to think about how we can move the patients to where the ventilators are. So we have a lot of ventilators in the bigger cities. And if we plan ahead and manage this well, we'll be able to shift the patients. And that's what the Netherlands is doing. They're really moving the patients out of the hotspot areas to the other areas where there are open ventilators. So it's going to be a moving of people and supplies, but the most important thing is stay at home, follow the social distancing that our governors put out very seriously, and then we won't have to get to that point, hopefully. Hopefully we can keep the disease burden underneath the kind of thresholds that we're seeing as far as number of ventilators and